anatomy, very short answer. It's important answers, question and answer. It is asked for, What are the types of muscle contraction? Muscle contractions are primarily categorized into isotonic and isometric. And isotonic, it's lengthy changes in the length of the muscles. And isometric, length will be stays constant. There will not be any change in the length of the muscles. And what is deglutition? What are the stages of deglutition? Deglutition is the physiological process of swallowing. Here the food or the fluid what we have taken through the oral cavity, it reaches to the stomach, involving there will be a coordination of the muscular action, and it consists of mainly 3 stages: the voluntary oral phase, involuntary pharyngeal and esophageal phase. Voluntary oral phase, here is the phase voluntarily we will be chewing the food, and the pharyngeal and the esophageal phases which happens involuntarily. Inferior vena cava. Inferior vena cava is the largest body's vein responsible for returning deoxygenated blood from the lower part of the body, that is below the diaphragm, and we know that right side of the heart always carries the impure blood. So that the inferior vena cava carry the blood to the right atrium of the heart. And axial skeleton consists of 80 bones. It forms the vertical axis of the human body, including the skull, vertebral column, ribs and sternum. The nursing implications of the coronary arteries. The coronary arteries focus on enhancing the myocardial oxygen perfusion and to manage chest pain and preventing complications through diligent assessment and education. So here the patient with the coronary artery disease, we have to perfuse with oxygen, and so we will start the oxygen therapy and manage chest pain and prevent complications. Types of cartilages with examples. So there are 3 main types of cartilages present in the human body: hyaline cartilage, elastic cartilage and fibrocartilage. And the hyaline cartilage example, that articular cartilage and its respiratory tract, nasal cartilage, and the elastic cartilage is present in the external ear, that is pinna, epiglottis and eustachian tube. Fibrocartilage, which is present in intervertebral disc, menisci and pubic symphysis, tendon and ligaments, that is the knee joints. What is terminal branches of brachial artery? The terminal branches of the brachial artery are the radial artery and the ulnar. Which major opening of the diaphragm is present within the central tendon? Mention the vertebral level. The major opening of the diaphragm present within the central tendon is the caval opening. The other name is called as vena caval foramen or caval hiatus. So the other name of caval opening, it is also called as vena caval foramen or caval hiatus. And the vertebral level, the caval opening is located at the level of T8 vertebrae. List any 2 non-respiratory functions of respiratory system. 2 non-respiratory functions of the respiratory system include vocalization, so that is production of sound, speech through larynx, since the larynx is called as voice box, and olfaction. Olfaction is the sense of smell. Write any 4 functions of liver. The 4 functions of liver, that is producing bile for digestion, metabolizing nutrients, that is carbohydrates, fats and proteins, and detoxifying harmful substances and storing essential vitamins and minerals. List the 2 types of nephrons and mention any 2 differentiating features. The 2 types of nephrons in the human kidney are cortical nephrons and juxtamedullary nephrons. Cortical nephrons and juxtamedullary nephrons. So the cortical nephrons have the short loop of Henle, and since the loop of Henle is short, it dips only slightly into the outer medulla. But juxtamedullary nephrons have long loop of Henle, so it's extend deep into the inner medulla. parts of the fallopian tube. So you can see in the diagram that isthmus, ampulla, infundibulum, fimbriae. The fallopian tube consists of 4 main anatomical parts that transport egg from the ovaries to the uterus. That is the infundibulum, that is a funnel-shaped end with the fimbriae, and the ampulla. Ampulla is the widest part where fertilization occurs, and the isthmus. Isthmus is narrow and muscular connection, and the intramural, that is interstitial portion part entering the uterus. The layers of the skin. The skin consists of 3 primary layers: the epidermis, dermis, and hypodermis. What is the difference between skeletal muscle and cardiac muscle? The first difference between skeletal and cardiac muscle, it is skeletal muscle, it is found in limbs, tongue, and all parts in association with the skeletal of organism. And the cardiac muscle found in the walls of the heart and large veins. And the second difference, skeletal muscles, here the fibers are unbranched, but in cardiac muscle the fibers are branched. And in skeletal muscle it is multinucleate, but cardiac muscle it is only single nucleate, that is uninucleate. And skeletal muscle, no oblique bridge and interlated disc, but in cardiac muscle oblique bridges and interlated bridge disc are present. Skeletal muscle, it gets fatigue soon, but cardiac muscle never gets fatigue. Skeletal muscle, it is voluntary in nature, but cardiac muscle is involuntary in nature. Define peristalsis. Peristalsis is the automatic wave-like movement of involuntary muscles that mainly lined in the gastrointestinal tract. So what is the main function of this? Means it is designed to move food and fluids through the digestive system. What is chloride shift? The other name of chloride shift, also called as Hamburger phenomenon or Hamburger effect. So it's the process that occurs in the cardiovascular system involving the exchange of bicarbonate and chloride ions across the membrane of red blood cells. Mention any 2 clinical features of acromegaly. The first one, enlargement of hands and feet. Second, Horsey facial features. The muscular artery. The other name of muscular arteries or distributing arteries or medium-sized vessels that deliver blood to organs and tissues, regulating flow via extensive smooth muscle layer. Types of bones. Bones in the human body are classified into 5 main types based on their shape and function. Long bones, that is femur; short bone, carpal; flat bone, that is a frontal bone; irregular bone, sacrocortex; and sesamoid bones. What is synovial joints? So the synovial joints, which is present in the knee, are the most common freely movable joints in the human body, characterized by a fluid-filled joint cavity connecting. State Landsteiner's law. So the Landsteiner's law, proposed by Karl Landsteiner in 1904, defines the relationship between ABO antigens on red blood cells and antibodies in the plasma. The main parts of Landsteiner's law, that is part 1, if an agglutinogen, that is antigen, is present on the surface of the red blood cells, the corresponding agglutinin, that is antibody, must be absent from the plasma. In part 2, just opposite to part 1, that is if an agglutinogen, that is antigen, is absent from the red blood cells, the corresponding agglutinin, that is antibody, must be present in the plasma. What is spermatogenesis? Spermatogenesis is the process of producing mature male gametes, that is spermatozoa, from immature germ cells occurring in the seminiferous tubules of the testes from puberty onwards. What is phagocytosis? So the phagocytosis is formed from the ancient Greek phagin, to eat, and kaitos is a cell, is a specialized form of endocytosis. Is a process by which a cell uses its plasma membrane to engulf large solid particles, generally 0.5 meter often described as a cell eating. What is lymphatic drainage of stomach? The lymphatic drainage of the stomach is a critical pathway for gastric cancer spread. So primarily draining into four main sets of perigastric nodes, that is left and right gastric, left and right gastroepiploid, and pyloric and pancreatico-splenic nodes. List the chambers of the heart. The human heart consists of four chambers divided into two upper chambers, that is atria, and two lower pumping chambers. What is positive feedback mechanism? Give one example. A positive feedback mechanism is a physiological process. Here the body senses a change and acts to amplify or reinforce. The body feels some change and pushing the system further away from the exact initial change. Example, childbirth, labor. During childbirth, the baby's head pushes against the cervix, stimulating stretch receptors. Name the layers of the adrenal cortex and the hormones produced by each. Here there are three layers: zona glomerulosa, that is secretion of the hormone, mineralocorticoids and aldosterone, and zona fasciculata. Here the secretion of the hormone is glucocorticoids, cortisol and cortisol. And zona reticularis. Here the secretion of the hormone androgen, testosterone and estrogen. What is myocardial infarction? The myocardial infarction, commonly we call it as heart attack. Here the blood flow completely reduces or complete cut off to the myocardium, so which results in tissue death of the gluteal muscles. Implications in nursing. Gluteal muscles or maximus, medius and minimus are crucial for stabilizing the pelvis and it powering hip extension, abduction and supporting the lower back.